guys, I hope you all had a lovely weekend. So today we are back with another video where I'll be talking to you all what are attachments or how are attachments placed onto your tooth surface. So attachments are basically small pearl-like things which are placed onto your tooth surface, which are used for the movement of your tooth. They serve the same purpose just like how the brackets do. Now there are different types of attachments, active and passive attachments. The passive attachments are usually placed on the molars of your teeth, which serve as the retention purpose for the aligners, and the active attachments are placed on the anterior surface of your teeth, which basically help in the movement of your teeth. Okay, now how are these attachments placed? Once you go for your orthodontic visit, where a dentist will be placing the aligners and the attachments prior to the placement of the aligners, what your dentist will do is he will clean your tooth surface. Scaling or cleaning will be done, and post that a polishing will be done. Now after the polishing is done, what will happen is after the polishing is done, the orthodontist will etch the surface of your teeth in which the attachments are placed with a blue colored gel or a blue colored liquid. Okay, now once this such a etching is done, that is probably a 30 to 40 second procedure, the orthodontist will wash it. Now once washing and air drying is done, a small liquid kind of thing will be applied for the enhanced attachment of this with your tooth surface. Now once that procedure is also done, the composites or the attachments which are going to be placed onto the tooth surface will be fixed inside your template tray and placed inside your oral cavity, and the curing will be done. Now what will happen is, once the curing is done, there is an extra procedure in Intalign which is actually a good procedure, which is called as rescanning after the fixing of the attachments. Now why is this rescanning done? It is done for the better adaptation of the aligners and for a better result. Okay, because when we fix these attachments, there can be some extra materials on your tooth surface which are called as flash. So to avoid that, so to also incorporate that in your movements, we can do it with the help of rescanning. Now after that, what is the procedure? Actually a good procedure which is called as rescanning after the fixing of the attachments. Now why is this rescanning done? It is done for the better adaptation of the aligners and for a better result. Okay, because when we fix these attachments, there can be some extra materials on your tooth surface which are called as flash. So to avoid that, so to also incorporate that in your movements, we can do it with the help of rescanning. Now after that, what is the procedure? Right? After that, after the rescanning is done, probably in 1 or 2 days, your aligners will be delivered to you. Now if it's an urgent case, or if you are going to abroad and all, the rescanning procedure can be skipped and your aligners will be delivered to you the same day when the attachments are fixed. Now a lot of queries I got last week was how to clean the tooth surface with the when the attachments are placed. Is it the same way, or do we have to do any extra method? So the cleaning is basically the same way on the tooths. Like not every tooth won't have attachments. So the tooths which are having attachment, you can just clean those tooths with extra toothbrush on all the 4 surfaces of the attachments. It's a geometrical shaped attachment. It will be a 3D thing. So just on all the 4th surface to make sure that there are no debris. And once you've confirmed that, use your mouthwash is given to you, provided to you by the Intalign, which is the Intalign demineralization foam and all. Then you can do flossing. Flossing. That's it. That's how you maintain your oral hygiene. Do attachments fracture? Yes, attachments can fracture. It's a very rare thing, but it does happen. Now if it happens, what should you do? You should contact your orthodontist and tell him specifically which tooth attachment is fractured, so he can basically give you an insight on how to treat the cause, or on how to what should be done. Will your treatment span will be affected? He can give you more idea or more knowledge about all those things. Okay, so that was it about attachments. So yeah, we'll get back to you with a new topic next week, same time, same day.